A new report is out by the Kaiser Family Foundation talking about the impact of work requirements in Medicaid. This comes at a time when over 11 states have asked permission to mandate work as a requirement to get Medicaid in their states, and Wisconsin is one of those states. And the Kaiser Family Foundation has dug into the reports of who is actually working, what types of jobs they have had, the relationship between work and financial stability, and challenges of fulfilling work requirements even for people with full-time work right now. Their findings are astounding. 6% of adult Medicaid enrollees targeted by the state's new work requirements are not already working and are unlikely to qualify for an exemption. So we're talking only about 6% of people that would be targeted as people being told you're mandated to work. It's a lot of administrative work to try to mandate work on these 6% of the population in these states. 62% of people receiving Medicaid or eligible for Medicaid are already working part-time or full-time jobs. 15% would be able to get an exemption because they are not in good health or they're not working due to illness. 6% are in school, 11% are caregiving. But the impact goes much beyond this 6% of people that would be mandated to work. We're going to talk about the relevance first, and then we're going to talk about some of those challenges. Work requirements in the Medicaid program has been a big political hot-button issue since the Trump administration took office, trying to mandate work to get healthy instead of get healthy to work. It's been a flip-flop of the way that we've been seeing requirements in the Medicaid over the last several years. Through what are called 11 and 15 demonstration waivers, and this is Section 1115, demonstration waivers where states can show that they can improve the Medicaid program by waiving requirements of federal law, and questionable whether putting work requirements is a way to improve the Medicaid program. But 4 states have already been granted approval to institute work requirements. 7 additional states have their waivers pending right now, and like I said, Wisconsin is one of those states. Most Medicaid enrollees, as the data shows us, are already working full-time, but their annual incomes are still low enough to qualify for Medicaid. So that's where this curious stigma attaches, saying Medicaid recipients don't work and we need to enforce work requirements. The data is showing us most Medicaid enrollees who are working are already working full-time, and they're just not making enough money to get out of that bracket of eligibility for the Medicaid program. Now, I said we were going to talk about some of the barriers that work requirements impose even on those people already working. The first one is many Medicaid adults face barriers in complying with the reporting requirements. A lot of the conversation in the Kaiser report points to people that don't have computer or email access, and some states, like Arkansas, mandate that you do online reporting of your work requirements. Well, there's a logistical barrier to even reporting your compliance. Difficulty claiming an exemption for people that have chronic illness or disability. They have a hard time doing the administrative and bureaucratic paperwork to claim the exemption they're entitled to. There are those that have difficulty working for those due to work-limiting medical conditions that might not raise to the level of disability or to the level of exemption, but still prohibit somebody from working. The American Cancer Society has been very vocal on this topic. People that have been undergoing extreme treatment, cancer treatments, who are then in remission but are not well enough to work 20 hours a week or 20, whatever the requirement in that particular state might be, are people that are, because of their work-limiting medical conditions, can't comply at this time with that work requirement. And then picture all of the other administrative hoops and hurdles of trying to report and comply with these additional requirements in the Medicaid program. Now, as you can imagine, there is a lawsuit. In the state of Kentucky, there was a class action lawsuit against the Trump administration's approval of Kentucky's very restrictive Medicaid waiver. Kentucky's waiver includes work requirements, premium, and lockout periods, very similar to what Wisconsin is proposing. It was approved in January of this year. The lawsuit is called Stewart versus Azar. Oral arguments are scheduled for June 15th in the U.S. District Court for the District of Columbia. They're going to be looking at the summary judgment action. Now, the National Health Law Program, the Kentucky Equal Justice Center, the Southern Poverty Law Center, and Jenner and Block, that's working with the National Health Law Program, are going to be taking this case against the federal government and the intervening Commonwealth of Kentucky. Now, Kentucky's waiver effective date is July 1st. The judge thinks he can have a ruling on summary judgment before then, but it's coming up pretty quick. We'll keep you posted as this challenge progresses and see what we can learn about it that might be relevant for our own state of Wisconsin and those other states that have pending waivers. You can read the Kaiser issue brief on this that talks about that 6%, that is the big number, and the number of people working that would not be able to comply with work requirements because of logistical administrative hoops and hurdles. You can also read the NHeLP Fast Facts on Stewart versus Azar. They have resources for advocates on their website as well as copies of their briefs and what they project will be in their oral argument, and a timeline of some other resources that are forthcoming that NHeLP is making available. If you have questions on work requirements or have opinions on the subject matter, send us an email, and you can do that at healthwatchwisconsin.org.